Bring your cup and take a seat. Fill it up, coffee, wine, or tea. Come find what you're looking for. A good pour.
Welcome back to A Good Pour. I'm Kathryn Good, your host. Today we have Mary Kathryn Oliver joining us. Mary Kathryn is the founder of the brand new Music City Pediatric Concierge, a new kind of pediatric care built around relationships and accessibility. She's redefining what it looks like to care for kids by making healthcare more personal, more available, and more focused on whole family well-being. Thanks for being here.
Thank you for having me, Kathryn. I'm excited.
So how many months in are we?
Yeah, we are 2 months in. We are middle of April? Yeah, we're 2 months in, exactly.
And so you have started this new practice in Hendersonville, which you were born and raised in.
Yes, my husband and I both were.
And so you live in East Nashville, even though I keep trying to get you to come here, right?
One day.
But you spend a lot of time in Sumner County.
I do. I laugh. I just sleep and pay taxes in Davidson County. But I shop a lot in Sumner, so I pay taxes.
In fact, we met at Leadership Sumner, right?
We did. Yeah, probably 5 years ago.
Okay, because I was your co-leader. We weren't in the same class. I was your co-leader. I remember interviewing you because you walk in and just everywhere you go, you're just a bubble of energy and joy. And I was like, well, she's in this class for sure. No one better argue with me. And no one did. So tell me why you picked Hendersonville.
Yeah. I picked Hendersonville because, as I said, my husband and I are both from Hendersonville. We have long-standing roots from great-grandparents. Grandparents have been here. Hendersonville is really our home. As I laugh, I just sleep and pay taxes in Davidson County. But over the years in our life, we have built relationships in Hendersonville. And I love Sumner County. I love being here, the vibe, just the passion for the city. And so we knew when we were going to open this that Sumner County was where we needed to start.
Yeah. So tell me why this is different.
Yeah. So at Music City Pediatric Concierge, I really wanted to bring a revolutionary way of relational medicine. I wanted medicine to be convenient for families, not when it was convenient for us. I wanted them to have the access. I wanted them to have a trusting relationship. And I just wanted it to feel different, give parents a different option than the traditional model, because that doesn't work for everybody. And so I was really excited as I had learned about this over the years to really be able to bring it. We're the only pediatric concierge practice in Middle Tennessee. There's a lot of family ones, and super thankful for this movement because I think, as I said, families deserve options. But we are the only pediatric. So taking a step out and doing that. But I realized I'm pediatric nurse practitioner. I've worked in peds really since 2004. And so kids are not just little adults. And so I knew that this was something that our community needed, and I was really excited to bring it.
So you went to school in Knoxville.
I did. Go Vols.
Nursing program there?
I did.
So you started off in nursing. Mm-hmm. You were our homecoming queen, right?
Thank you. Yes, I was.
I remember that. I think from leading you, that was like your 2 truths and a lie or something. And yeah. So yes, go Vols.
It was fun.
And so you graduated the nursing program, and then did you continue on immediately, or
so actually, when I graduated with a bachelor's of science in nursing, I went to work at UT Medical Center. I worked in their neonatal intensive care unit and their pediatric intensive care unit. They had a really great program back then. I loved bedside nursing. I loved what I did, but I also loved school. And I knew I wanted to keep going. And then UT Medical Center had a really great program. They paid for most of my graduate school while I continued to work. So I did a dual program. I worked full time and went to school part time to get my master's of science in nursing, where I specialized in primary care pediatrics. Okay. It's what I'm here for.
So you've been in peds
since the beginning. Yes. So really, college was 2004, 2008. As soon as I came out, I started working immediately in the NICU and never looked back.
Why kids?
So you'll laugh. I actually thought I wanted to go into adult oncology. The way nursing has it, you kind of sign up before you ever leave. You know where you're working. And so I had actually told UT Medical Center, yep, give me a job on adult oncology. Because as a nurse, You want to save the world? That's what we think we're going to do. And I didn't really know any different. The very end of nursing, they put you through an externship, and mine was in the neonatal intensive care unit. You just get assigned, and that is you don't know. Okay. And that is when I fell in love and realized this is where I'm supposed to be. So I went to HR at UT Medical Center and I said, I know I haven't started, but can you switch me? And they did. And it was so great and so thankful for that time and those relationships with nurses and families. I still keep up with a lot of those families because, and that's why, I mean, all of nursing is a calling, but I really, in pediatrics, I love the whole family aspect of getting to know them, getting to see those kids grow. So it's really fun to get to see that now.
Yeah. Talk about how healthcare's changed.
Yeah. Woo. So even from what I've been a pediatric NP for 15 years now, over the 15 years, really just seeing the difference of even from allergy testing, things that we used to withhold peanuts from kids because we thought that was the right thing to do. And that's what research showed us. Now we're saying, oh, just kidding. We have this whole generation now that's allergic. Now we need to give it at 6 months. Here we go. So really being able to see like, okay, adaptive, as we learn, we are growing. And I think that's what's always been intriguing about healthcare and medicine is we're always learning and we're always growing, and being able to stay up to date on that. I think another big thing I've seen in healthcare is just parents want choices. Things 15 years ago we didn't talk about, now we talk about now. Parents have concerns, questions that they didn't know they needed to ask back then. We have access. Social media is telling us a lot of things.
Dr.
Google. And being able, and I think as in healthcare, we have to acknowledge that. If we don't acknowledge that, we're going to get stuck in the times. And so knowing that I want to be the safe space for parents to land of, hey, I saw this on the internet. Is that real or is that not? And so I never want parents to have, to feel like they have to have their guard up because they have a question or they've thought something. I always want to be the safe space of, hey, come to me. Let me help you. Let's talk about that. Or that's interesting. I have not heard of that new vitamin, or I don't know, something, let me look it up though. Let me give you some research on that.
Yeah. So walk us through, like, my kid gets sick on a Friday night. Walk us through what I would traditionally be used to, which I will explain it so you don't have to. Like my kids, it's not during normal office hours. I'm either going to an urgent care or I'm calling my pediatrician, and being, they may not be on call, and then you're kind of stuck in a phone tree, or just waiting on a call from a doctor. And then you might get an answer and then it's a call us back. And, then you're maybe not talking to the same doctor. I mean, there's all kinds of things that can happen. So because you can offer this model, what does my Friday night look like now?
So I love our Friday nights because they're usually at a ball field or they're at a cheer competition. We are all on the go and no one has time to sit at an urgent care for 2 hours. So I was really excited at Music City for our members. They have direct access to me. So we have a really user-friendly, app that allows them to direct text message me. So they've got that concern. Hey, it's Friday night. We're heading to brother's ball game. We've, got this fever. What do you think we should do? And so by being able to have that direct access with me and have that relationship of, I know that family, I know this kiddo, I know his medical history. I'm able to walk mom or dad through that of, hey, not an emergency. Let's handle it this way. Let's plan to talk in the morning. Saving family that urgent care visit bill, which was one, the time, or feeling like they have to rush to an ER if they're out of town at said ball game on a Friday night, So really having that direct access, I think, helps to be able to bring that parent fear down and give them sound advice of that we can get through this.
Yeah. Claire's going to be embarrassed when I tell this story, but the main thing I think about when I think about a Friday night was when I looked down at my child's hair and saw tiny bugs crawling. And so why I even called the doctor, I don't know, because clearly I knew what it was. I needed to talk to somebody. But I remember this was Clara was tiny. And I remember sitting in that phone tree. And again, now looking back on it, there was nothing they could do. They were like, yeah, if you see tiny bugs, then that's probably life. Although you could have told me exactly what to buy, and probably I could have called you from the drugstore and said, all of those things.
Instead of frantically sitting up all night and worrying about it.
Yeah.
Make nerves of ourselves in our room.
One of the worst parts of childhood for sure. Anyway, I'm sure everyone wanted to hear about that today. But what do you feel like what are the common questions, what kind of formula? And there's things that are like every new mom's going to have, or, I don't know, like there's common ones, but what do you feel like you're hearing a lot lately?
So I love especially the direct access for the newborns and those younger kiddos, because they just come with a lot more questions. They tend to get into a lot more things. They need a little bit more handholding. And I love that. I've been with, like I said, babies from the NICU in the beginning. So, in the beginning, there's a lot of questions of like, hey, we're having some formula issues, or we're having trouble finding said formula. What are some alternatives? And so being able to have that text message straight with me when they're at Walmart or Target, or just for the other day, I had a mom text me like, should I buy this oatmeal or this oatmeal? I'm standing in the aisle and there's 5 of them.
And so what's their concern? Is it sugar content? Is it artificial? I mean, what
of it's artificial for sure. And then interesting enough, one of the boxes that she sent me was an oatmeal that already has some pre-packaged allergen exposures in it. Well, her child wasn't quite old enough for that. So, but as a new mom, she didn't really know that. It was oatmeal there. So to be able to say, oh, look, nope, hold on, save your money. Don't buy that one. In a couple months we will, but not just yet. And so, and then trying to be able, she's saying, well, there's rice cereal here. Do I buy that? Okay, well, let's talk about why I would not recommend that and why I would say do oatmeal. So it's kind of some of those, not medical questions always, or we're going on our first trip and we don't know what kind of sunscreen to buy. They've had a little bit sensitive skin, so which one do I choose? And so I enjoy being able to be a part of that family relationship, be a partner to them, and give them some sound advice as a friend would. And I'm excited that families can bring me into that part of their lives.
Yeah, for sure. So we talk about good work on this podcast, and just so you've had a long history in the medical field, especially starting in nursing. So why should we appreciate nurses?
I love that. I think as nurses, nursing is a calling. Whether we had that calling as a kid or whether we had that calling later in life, we all have something in our hearts and our brains that tell us like we should do this. We're signing up to be the calm in the chaos. A lot of times we're signing up to be there for those families in some of the harder times, but also getting to celebrate the wins and the joys. I see magic all the time, whether that's in the hospital, clinics, phone nurses, school nurses, the magic they bring every day through the critical thinking of, I got to think on the fly. This was not in the manual, different things, the compassion they bring no matter what, and the advocacy. We don't get off days. We don't get days where we show up and we're just kind of tired. Nurses have to show up 120% every day, but they do because they love it. And again, that goes back to that calling. I think they have a passion for caring for their families as if they were their patients. And so, I'm so thankful for my background as a nurse. I would never trade it for a million years. I loved bedside nursing. Sometimes people ask me, did you not like working in the hospital? I loved it.
You just love school too.
I love school. I love education. And so I think just super thankful for our nurses that show up every day with that compassion and the hustle. Knowing that their families might have woke up not feeling well themselves, their own kiddos, and they're having to get them places and kind of put that over here. And we show up with our A game. Because I don't think we realize that we really, as nurses, have such an impact on families' lives every single day. Mm-hmm. We show up and do our job because we love it. But the impact that we have, I don't think we always realize that we get to impact people's lives daily. And not everyone gets to do that in their job. And so super thankful for that. One of the other things I was going to say, through my years, I have done adjunct, I've taught nursing clinicals, I precept nurse practitioner students now.
So what does precept mean? Just in case someone didn't know.
Awesome. So training. So when you go through nursing school, you go through graduate school to be an NP, you're required to do so many hours under a licensed professional. And so in school, I had some amazing preceptors, people I'm so thankful for this day that really helped me figure out how you function during the day and in these new roles and learning and just how you treat families. And so that was something I really wanted to carry on, kind of back to that education. I love teaching. And so just to our nurses, I'm super thankful for those that are stepping up in those roles. And if you've been thinking about it, just do it. They're so happy to have you as a teacher and preceptor. Just do it. You'll love it. And again, we're all in this together. We've got to keep growing this industry. And so, yeah, that was my.
I love that. Talk a little bit about the keep growing the industry. Or is it on a decline? I mean, I know we wore our health professionals out, a few years ago in that era we won't talk about, but are we coming back? I
think burnout's hard all the way from physicians, PAs, nurse practitioners, nurses. I think it's all hard. We've all been through years that we really didn't think we would be in. Dealing with insurance companies is hard. And all while we're just trying to show up and do our calling, take care of families. And so I think colleges are still filling in with these nursing students. Children, they're 18 years old, still get us showing up so eager to join the profession. And so I think we are at such a pivotal point where we can create outlets and avenues where they are able to thrive, where they don't show up and go, oh my word, what did I sign up for? How do I get out of this place? Instead, creating environments where they can continue to grow in things that they're passionate about, education, collaboration. I think lots of times things can be isolated. And so nurses feel like we just do the job, but no one really asks us things. Nursing organizations and groups, they are the biggest advocates for our patients and themselves. And so I think being able to have an environment where it's a collaborative, I think will continue to help us grow and have people still showing up to do the good work.
Yeah. Okay. So talk just a little bit about what is different about a concierge practice, because that's a word. You're the only one in Middle Tennessee. So it's a word that people might not understand. Yeah. So tell me what that means.
So it's interesting. Concierge and direct primary care kind of go hand in hand. Concierge is a word that just, when you say that, people understand it a little bit more than direct primary care, but they are hand in hand. And what that is that I work for you. I get to work for you, walk alongside you, almost back to old school medicine, relational based. You're not just a number. And you're able to do that because we're able to kind of keep our panel, as we would call it, which is our number of members, our patients, at a point where it's manageable with just me. When we get in these big practices, it's hard because I can't manage 4,000 patients by myself, But with concierge and direct primary care, we're able to keep it on a small scale to have that relationship with our families. So with that, I'm able to eliminate a waiting room. When patients come to see me, I greet them at the door.
They can run up and down the hallways.
They can run up and down the hallways. In my office, it's just me. And so the other day, I had a little 3-year-old and he needed to run, and I could see it immediately in that mom's eyes of she was about to tell him to sit down. And I said, no. This is us. This is a safe, free space. He can run as much as he wants to. And you could just immediately see her like, okay, we're going to be good. And so being able to provide that environment of no waiting, it's just me. You're not worried that you're going to get an illness from somebody else in the waiting room. Because let's be honest, in sixth season, we're everywhere. We're at Walmart, Target, all the things. But no waiting room. I greet you at the door. No rushed visit. I tell families, you can hang out with me as long as you want to. You can come see me every day if you want to. That's included in that concierge membership is unlimited access. So that's text message, telemedicine, if that's more convenient for you. If you're at Nashville at work and your kiddo's at school and then school nurse is calling you, let's jump on a video chat together. Let's try to help figure out this for what works best for your family. And then that follow-up. I love being I'm the one following up with my patients. They're not having to call back and get lost in a phone tree like we talked about. I'm also the one making the referrals. So I'm the one reaching out to the specialist saying, hey, I've got this going on and I want to give you a heads up of what's going on. And sometimes we can actually save parents a visit because the specialist will say, hey, why don't you go ahead, do this first, then let me know. And so again, being able to decrease that healthcare spend for families. And so again, it's the relationship, it's the direct access, it's the tailored treatment plans for those families that I think is really what sets us apart.
That's amazing. It is It is a journey to start a new business. It is even more of a journey to start one that is the only one in Middle Tennessee, because there's an education component to that. On top of that, you have 2 children. One that is doing dance and cheer, I believe, which has got to be like every weekend.
Yes.
And your son is also a dancer and a ball player.
He takes hip hop. Yes. Sweet little
love
boy
that.
and a little T-ball.
I love that. And a wife and all the things. So how do you fill yourself up so you can continue to have as much joy as you do?
It's really been, as you said, a journey. And really, it took me 15 years practicing as an NP to find what brought me joy. And that was being able to serve families where they were at, but also be able to pick my kids up from school a couple times a week, help them with homework, get them to those practices, just hear how their day is. And so I was really thankful to find direct primary care and concierge, because I think it brings joy to me to be able to be involved in all the things. I've been that way my whole life. I think that's my mother that, created that in me. And so I do find, I do find great joy in being able to be present for my patients, for my family, but for our dance and our cheer families too. We've created great relationships. And so I love being able to be a part of that. And we get outside. We're big lake people. So I say in the summer, time stops when we go out to the lake. It feels like, but I still have my phone.
I was going to say, unless you're on that app.
But I tell parents, you may hear a kid in the background, you may see some water behind me, but I am here for you.
But that is part of the relationship, right? That you have a life too, and that they can see that. And there's something special, I think, that you bring to the table that way.
Thank you.
Well, thank you for joining us. I'm cheering for you. I've always cheered for you, but this one it's needed, and it's bright and colorful. Can't wait for people to see the website and the brand. And I did not do it, so this is a genuine compliment. But I'm just excited.
Just a quick little thing. So Leadership Sumner is how we met 6 years ago. And really that was such a pivotal point in my life of, hey, you can do this. Like being just around people like Sweet Kathryn, like-minded business owners of, you can do this. And I think that's the joy in nursing. There's so many avenues and facets that can take men and women in so many different directions. And so I just want to thank you too, because that was a pivotal point in my life of like, hey, you can do this. You can go.
Yeah.
So,
and I believe Leadership Sumner has applications. The deadline may have passed by the time this is open, but there's always next year.
Always next year.
I love what you said of, you can do that. You can do this. And, we all have different seasons in our life where we need that reminder, no matter what industry we're in, that we all have ideas and we can do it.
We can do it together.
Thanks for joining us.
Thank you for having me. Thank you.